Hello all, welcome to your shift today. I'm just here to give you a handover on your patient Betty Graham. So is everyone ready to go? Okay, so our patient today is Betty Graham. She is an 82-year-old female who was brought in by ambulance following a fall at home. Her date of birth is the 25th of August 1934 and her MRN is 1123409. Is that correct, everyone? She's under Dr. Kennedy. And you guys will be taking over care on the ward. Okay guys, so as mentioned before, poor old Betty got herself into a bit of a situation at home when she took a fall. In emergency we did an x-ray which showed 3 fractured ribs on her left side with a pneumothorax. Okay, now Dr. Kennedy inserted an intercostal catheter with an underwater seal drain. Now the underwater seal drain has been re-x-rayed again to ensure it's in the appropriate place. It's been reviewed by the medical team and they're happy with the placement of the underwater seal drain. This is having a good effect. We gave Betty 8 milligrams of intravenous morphine to good effect, and it's lowered her pain relief to a 3 out of 10. Now she's charted for further subcut morphine on the ward with you guys for further pain relief if required. At the moment, she is settled and comfortable, but please continue her pain assessments. Betty has complained of a tiny bit of pain at the laceration site on her forehead. She's got an IV cannula in situ and she requires normal saline to run at 80 mils per hour. I'm so sorry, I just got caught up with my other patient, so I wasn't able to hang the line. So it would be really great if you guys would be able to do that for us. Now she also has some steri strips, as you can see, on her forehead, so please continue to review the dressing and alert the team if she starts. Can you also just ensure there's no signs of infection, and if there is, please alert the medical team. Now Betty also requires a falls assessment to be conducted. Again, I'm sorry, we just got so busy in ED and we were unable to do this. Now, good old Betty, she lives alone at home but is fairly independent with her ADLs and everyday living, though she will require assistance in hospital due to the underwater seal drain and the rib fractures. She's got a past medical history of hypertension, which is managed well with Metropolo. She has a history of vertigo, no current medications, and regularly takes Panadol for arthritic pain in her hands. Her observations have been stable since the intercostal drain has been inserted, but the doctors would like hourly underwater seal drain obs, hourly neuro observations. They want you guys to commence IV fluids at 80 mils per hour, and that's been charted on the fluid chart. She may need a dressing change for her head lac on arrival. She's got PRN analgesias charted. She's got a falls risk assessment is required to be undertaken. She can have a full diet for now. And you might want to get social work involved because she's concerned about her cats at home and has requested to phone her neighbour as soon as possible about that. I did page social work, but they didn't get back to us. It's pretty, as I said. So I hope that kind of gave you a really good insight into Betty. If you have any questions, please let us know. Her belongings are on her bed. She's had something to drink and a little bite to eat in ED. And yeah, that's all I could say. Hopefully you get a bit of a picture on Betty, and good luck with her care.